Nurse practitioners and physician's assistants are performing procedures today that they're not trained to do. Uncle Sam has replaced physicians with nurses and PAs by valuing their care at 80 to 100% of what physicians are paid. This is the grandson of my office nurse, and he fell from a truck, and his mother made the huge mistake of taking him to an emergency room where a physician assistant saw him, was never seen by a physician. And what did they do? They glued his forehead. Now, this is going to leave a bad scar if it doesn't get infected first. Here is a person, a lady who had a nearly circumferential dog bite and sutured by a PA very loosely, and after a month she was tired of dealing with it. She was sick and tired of a bad scarring and non-healing wound, so she came to me and she wanted it redone, and so I had to take it apart and redo everything, and she was very happy that I took the time to do that. And here's a patient of mine for over 20 years, and he was working with a piece of wood and a table saw, and he went to the emergency room, made a big mistake again, and the nurse practitioner just sutured it up. There was bony injury, and there were nail bed problems, and she just loosely sutured it. And then she calls me and says, will you please follow him in your office? And I asked, well, why didn't you call me to start with? Well, we do these things all the time. And so I saw him in the office the next day, and it was so poorly done, it would have left a terrible nail bed deformity. And I redid the whole thing, and he was very glad that I had to take it down and redo the whole thing. So it doesn't save any time, it doesn't save any money, it's just more aggravation. Here's another guy who was in a bad auto accident, and the PA sutured him. Not only was it a very irregular suture job, but there were skin fragments that were buried deep under the skin, would have left cysts, and furthermore, there was a branch of the facial nerve that was severed. So I had to completely redo everything, take it all down, and clean it up, and repair the nerve, and all of that. And he was very glad that I took the time to do that. Here is a young veterinary student. She was bitten by a dog, gouged out a piece of her lip, and the nurse practitioner was very irate that she wouldn't let her do it. And so she came to me, and so I had to fix it properly, and she was very glad that it didn't leave much scarring at all. But it was a bad problem that would have left a bad scar. Here's another fellow who I was asked to see. He was in a bad motorcycle accident, and I was asked to see him because he had a facial fracture. Well, his facial fracture didn't need any surgery, but I noticed this big rock in his forehead. And so when I went to see him, here, lo and behold, it was all covered with glue. And I thought to myself, you know, I wonder if they took that rock out. And I tried to find out, and nobody knew. So I finally had to take all of this glue out, take the rock out, fix lacerations that they were ignoring and were not going to fix, debride all the abrasions and all the other things. Gluing wounds on the face. Here's a nurse, and she was an emergency room nurse, actually. She was in Florida, and she was in a bad auto accident, and they came at her, the PA did, with a staple gun, and she said, no, 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 don't do this to me. And they shot her up with Versed and did it anyway. And so by the time she got to me, she was an infected mess, and I had to redo everything. There was, again, a branch of the facial nerve involved, and I had to clean it all up and repair it properly, and she was very grateful that I took the time to do that. Here's a veterinarian who just the other day, just a few weeks ago, I was called by the PA in an emergency room, a little outside of Dayton, but he was a veterinarian. A dog just bit a chunk out of his lip, and the PA called me and asked me if I'd just follow him up. I said, well, don't you think we better take care of it now? Well, if you want to. So he sends him to the emergency room where I was, and I clean him up and fix him up, and I asked him and his wife, were you ever seen by a physician? Well, no, we weren't seen by a physician at all. We aren't even sure that there was a physician around. All right. So he was very glad that I took the time to do him and fix it that same evening. So I took, doctors these days are being hired to do quality work in the various hospitals. And so the hospitals are hiring doctors to ensure that there's quality. And so I went to the doctor that does the quality, is paid by the hospital to do it. And I said, look, I'm having these problems with some of these folks who are doing things they're not really trained to do. And he just shrugged his shoulders. He says, well, I don't know what we can do about it. PAs and nurse practitioners have now replaced physicians. They didn't participate in MOC because they never were board certified in the first place. They never did a residency and never even went to medical school. Some conservatives maintain that there is a free market between doctors and PAs and nurse practitioners. No, there is not a free market because there are strict price controls for physicians, and the price controller values PAs and nurse practitioners at parity with doctors. There can be no free markets under price controls, and without free markets, there is no freedom, not for physicians and not for patients either. By definition, free markets cannot exist with price controls. A Dayton area plastic surgeon of mine has a new business model, and what he does is he hires nurse practitioners who travel a route to line up patients for excision of skin cancers and other things. And he asked me to participate at 55% of Medicare. Now, my question with this scheme is, will these nurses be primed to overdiagnose and schedule much unnecessary surgery? What happens when they miss serious problems, such as melanoma? They're not trained to do these things.